Cancer is a devastating illness, and the thought of being diagnosed with it is frightening. However, the sooner you realize that something is potentially wrong, the more likely it is that you will recover. By knowing which signs and symptoms are usually associated with cancer, you're empowering yourself with the knowledge, understanding, and ability needed to make informed decisions for yourself. Following is an overview of 10 signs and symptoms that may be indicative of cancer, accompanied with a detailed description of each one. We create content for curious and inquiring minds, so don't forget to subscribe to the channel for more informative and enlightening discussions. There are more than 200 different types of cancer, and each of them can cause many different signs and symptoms. While some are specific to the particular cancer, there are others that are quite general. Of course, you don't have to be aware of every single sign and symptom of cancer, but the ones that are explained here should give you an indication of what you should be looking for. More often than not, they are a sign of something far less serious. If it is cancer though, spotting it early can make a massive difference. Anyone can develop cancer throughout their lifetime, but the vast majority of cases occur in people who are at least 50 years old or more. Whatever your age, just listen to your body and consult with a medical professional if something doesn't seem to be quite right. This applies whether it is something that hasn't happened before, is unusual, or isn't going away. Number 1. Fatigue or exhaustion that doesn't go away with rest. For example, you are constantly feeling tired and lethargic no matter how much you rest. This would also cover things such as feeling breathless after mild physical activity or unexplained weakness. Number 2. Unexplained weight loss. If you have lost more than 10 pounds of weight without trying to or for any other unexplained reason, then it should definitely be looked into. Number 3. Problems with eating. This covers a broad range of signs and symptoms, including sudden change in appetite, problems with swallowing food, consistent stomach pains, persistent heartburn, serious indigestion that won't stop, as well as dizziness and nausea. Number 4. A swelling or lump anywhere in the body. A swelling may be accompanied by redness, pain, and itching, or it may be completely painless. The same applies to lumps. They can also be smooth and soft or bumpy and hard. Number 5. Skin changes that develop either slowly or suddenly. For example, you might have a lump that starts to bleed or becomes scaly, a new mole or a change in an old one, a sore that does not heal, or a yellowish tint to the skin or the eyes. Number 6. Bladder changes. Everyone's bladder works differently, so it is essential that you know what is normal for you so that you are aware of any unusual developments. Needing to pass urine more or less often accompanied with pain or blood in the urine requires medical attention. Number 7. Coughing, chest pain, and breathlessness. If you have been experiencing any of these for more than a couple of weeks, you should make an appointment with your doctor. They can be caused by something as harmless as a cold, or symptomatic of another serious condition such as pneumonia. Number 8. Changes in bowel habits. The condition of your bowel is generally indicative of your overall health. Report any changes in bowel habits such as constipation and diarrhea, as well as blood after a bowel movement. Number 9. Pain. You should never ignore pain, especially if it doesn't stop after a few hours or when you've tried to relieve it. Consult with a doctor if anything is causing you discomfort. Of course, you should bear in mind that many cancers don't hurt. A lump or swelling that isn't painful is still a cause for concern. Number 10. A mouth or tongue ulcer that doesn't heal. Compared to other parts of your body, it can be more difficult to detect a mouth sore. It might look like an area that is whiter and doesn't scrape off, or an area that is redder than the rest of your mouth. In either case, you should have it looked into if it hasn't recovered after a couple of weeks. These are some signs and symptoms that are typical of cancer. It is important to remember that presenting with one or more of these symptoms doesn't necessarily mean that you have cancer, and neither will you always display these signs even if you did. Still, the earlier your cancer is detected and diagnosed, the higher your likelihood of recovery. If you have any of these signs and symptoms, or anything else which concerns you even the slightest, then make sure to consult with a medical professional as soon as possible. We hope that you found this video informative, and if you did, then please like, share and subscribe to this channel for even more content.